Appreciate that. Well, we're getting a fewer cameras, so must be getting back to normal. Oh, somebody want? Yeah, get that door. Thank you. Well, I'm joined today by my wife, Fran, Bruce Vanderhoff, of course, the Ohio Department of Health, Chris Cook, the Health Commissioner here in Clark County, Melanie Flax-Welt, County Commissioner, and Mayor Rob Rue. Today we want to give you an update, and what we are announcing today is the opening of the mobile health clinic. Mobile health clinic, which you all walked by as you came in here. It is actually started up today. They've already seen some patients. The goal will be to keep it here at the health department for a while. The goal will be to reduce wait time for vaccines and for other health needs in the community. The reason and the challenge that is faced by the community is the primary care health system is strained. It is stretched by the large number of people who are in the community and the upsurge that has occurred over the last 3 to 4 years. What this mobile clinic will do is will benefit all the citizens of Clark County, all the citizens of Springfield, whether they're Haitian or whether they have lived here all their lives. This wait time that the health department is experiencing here, which is just one indication of the strain on the primary health care system, which the Health Commissioner will talk about in a moment, is just one example of that challenge that we face in the community. So the goal will be to reduce that wait time. The wait time is, I think, over 2 months now. That's not acceptable, and that has to be changed. And we believe that the mobile health clinic out here will certainly be able to do that. After that, it will be moved around the community, again, into different places where people are used to going, and it will continue to be, I think, a great help. Our goal will be to, in the future, move from the mobile health clinic to a permanent health clinic. There's also the possibility that, depending on the need, you could end up having both for a while. So we will see. This is something that the state has been very much involved in. This is a cooperative effort between our administration, the Ohio Health Department, as well as the Clark County Health Department. Let me just maybe touch on a few other things. Fran and I spent part of Sunday and a good part of Monday here in Springfield looking at different things. One of the things that we focused on was driving and some of the challenges that are faced there. So we don't have anything to announce today on that, but there is work in progress in regard to getting drivers training out more robustly in the community. We have invested some state dollars in that some time ago, and we're working on that right now. It seems that the situation here has calmed down some. We still have received some threats, but I know Andy Wilson was in the schools today along with our troopers. Our troopers continue to be in the school. They will remain there as long as we think and the school officials think that it's necessary for them to be there. Everything seems to be pretty much back to normal. So now let me introduce Dr. Vanderhoff, who will talk a little bit, and our Health Commissioner, Chris, will talk after that. Thank you.
Well, thank you, Governor. I want to really express my appreciation to the Governor for your leadership on this issue, his caring, compassion, and especially your dedication to getting these healthcare resources here so quickly. To be able to go within a week to having a mobile healthcare unit here is really extraordinary. I want to begin by echoing the expressions of appreciation that the Governor offered to this community, especially to so many who've responded in so many wonderful ways to help address this challenge. And I want people to know, on behalf of the Ohio Department of Health, that we're here and we're going to remain in this community throughout this time of challenge. Our mission at the Ohio Department of Health is to advance the health and wellness of all Ohioans, regardless of where they live, regardless of where they work, regardless of who they are. And that is in large part while we're here. And I want to reiterate that this mobile unit and other services that we're bringing into the community are here to supplement and expand so many of the really wonderful resources that have already been put into place and are already working on behalf of the people of this community. We are not here to compete with or to replace any provider, any organization that is already a part of this community. We are here to support them. Now, there is a lot of simply outstanding work that is being done here in this community. It's a community that is truly blessed to have some of our outstanding partners, who include the Rocking Horse Center, Mercy Health, and so many other organizations. I really could not recount all of them. Now, knowing that, I do want to outline, though, very briefly, some of the priority healthcare services that we're going to be focusing on in the days and weeks ahead. The first and foremost of which are vaccinations. It is imperative to the health of this community, adults and children alike, that people be able to receive immunizations in a timely manner. Immunizations simply are the first line of defense in helping to prevent disease and illness in any community. Being able to receive a vaccine against very important respiratory viruses like flu, like COVID, RSV, as well as other diseases that can spread very easily, like measles and whooping cough, really makes a huge difference for a community, because when these contagious illnesses occur due to a lack of vaccination, they can spread through communities very rapidly, having a very negative impact on workplaces, on learning environments, on whole communities. And a simple shot can prevent all of that. So that's why we're putting so much emphasis on getting those wait times down. Now, as the governor noted, as we reduce the wait time for vaccinations, we're also more and more going to be helping to support the local health department and its partners in delivering essential health care services. And the governor outlined a little bit about that. I know Commissioner Cook will speak to that in more detail. In addition, we recognize that there are real needs for maternal, prenatal, and infant health care. And I want you to know that staff from Ohio's Women and Infant and Children's Program, commonly known as WIC, are already on the ground working with Commissioner Cook and his team to expand access to those vital services for all the mothers and young children of the Springfield community. The bottom line is that the essential health care that we deliver through the mobile clinic that you see out in front of this building and the more permanent clinic that will follow are going to be essential in helping us to elevate the quality of care that everyone in this community is experiencing. And I have every confidence in Commissioner Cook and his team, as well as in my team and the many partners that we're working with, that together we can expand access, we can provide more in the way of vital healthcare services, and in the end, elevate the overall health of the Springfield community. And with that, I'm going to turn it to Commissioner Cook.
All right, thank you, Dr. Vanderhoff. Thank you all for coming today. You get to see a little glimpse of the hard work that the health department has been doing for years, but has an opportunity to reach further in the community as we add this mobile clinic to one of the tools that we have to serve all of our population here in Springfield and Clark County. This community, it's where I work. It's perhaps more importantly, it's where I live. This is where I'm raising my family. And so for me, I think we all want the same thing. We want a thriving, healthy Springfield in Clark County. And I've got personal stake in that, as I've expressed. I want to extend a heartfelt thank you to Governor DeWine and First Lady, really for spending time with us, first of all. You have taken the time to see what we're doing here in Springfield and Clark County. You've understood it, and then you've taken action. And that's what we're here to see today, is that action. It's my honor to work with the leaders that are up here that actually understand and then put legs under the things that they say they'd like to do for this community. I also want to say thank you to Dr. Vanderhoff and your staff. They've been invaluable over the last week to deliver this mobile clinic here and expand capacity right now. So I'd like to take an opportunity to highlight some of those services that we're offering. We started offering these services today. We've actually had people seen in the mobile clinic already today. So we wanted to take advantage of the resource that you gave us as quickly as possible. So first and foremost, as Dr. Vanderhoff said, we want to offer these services to everyone in the community. We're starting with immunizations. We're starting to see, again, as we've come out of the years of the pandemic, that people were a little bit behind in areas in their health care. So we want to be that bridge that gets them to primary care, and it starts with those immunizations. And we're adding to that some basic screenings, such as blood pressure screenings and hemoglobin A1C. And so really the purpose of this is, it's not to be a primary care home. That's not what we're equipped to do at the health department. But what I'd like to see us do is be that re-entry into the healthcare system. If it's been a while since you've seen a doctor, maybe you fell behind on your screenings from the pandemic times, and you don't know how to re-enter. That's what we want to do. We want to be that bridge to get you to primary care and manage your chronic conditions going forward. So all the things that we're talking about were things that we knew we needed to do anyways. They were in our community health assessment. So the data backs up the need for this very clearly. So we're not urgent care. We're that bridge to be able to get to that long-term care. The next thing that we want to do as we transition to that permanent clinic is we want to add basic, I'm going to call them core health screenings. So oral health screenings, mental health screenings, getting your physical health measured and see where you're at based on your age, and getting those vaccinations done. Start medications for chronic conditions that maybe you've been ignoring for a minute. And so we want to be that bridge. We want to bring those services as we advance the mobile unit into the community and then transition to a permanent location. So for the next 3 weeks, you're going to see that mobile unit here. And I know after we're done here, that's what everybody wants to see. They want to see inside the mobile unit. It's a fantastic resource. And so for the next 3 weeks, it'll be here, and then we're going to move into the community where we know there are needs. We've already made connections where we're going to put this in the community, places like United Senior Services, St. Vincent de Paul. So we're working to find those high need areas to break down any barriers to care here in our community. So as an example of how this is going to help our community, I'd offer this. The governor and Dr. Vanderhoff have talked about getting that wait time down. And so we have actually forecasted, we think with mobile operations here for about a month to a month and a half, we're going to be able to get those wait time downs for immunization appointments to around 2 weeks. Our ultimate goal is we'd love to be able to have same week appointments and even take in some walk-ins as well. So we're making appointments and walk-ins available very easily to the mobile unit. You can call our office, and you can also do it online. It's very simple. We've got some flyers we'll distribute, but if you go to mobile.clark.health, that's all you have to do, and you can sign up for an appointment to be seen at the mobile unit. You can do that right now. And for the latest places we're going to take this, you can just go to clark.health. It's that simple, and see a list of the places we're going to be in the community. So ultimately, we're going to increase capacity and access to service for the entire community. It's one component of the healthcare system. We've mentioned our partners like Rocking Horse and Mercy that are beyond these four walls of the health department. We know so much of our public health goes way beyond the health department. This mobile clinic is going to enrich our community with high quality resources. We're here to serve the entire community, and the entire community is going to come. We feel very confident that once this gets out, we're going to be serving a lot of people, because our cultures may make us different, but our community all makes us one. So thank you.
Happy to take questions. Yes.
Catherine of the WYSO. there a fee for people to use this mobile clinic? And then how do they make appointments online, or can they make
we'll
them
let you-
or call away?
We'll take that, Chris.
So the easiest way to make an appointment is just go to mobile.clark.health. You can call our office at 937-390-5600. And again, we're going to try to be able to work in walk-ins as we can. So if you're cruising by and you actually see it someplace, stop by. We might be able to get you in as a walk-in. So what we'll do is we're extending our operations here at the health department to this mobile unit. And so we do not turn anybody away due to inability to pay. That's one of our core tenets. But we will take, if people have insurance, it certainly helps us that we're not eating all those costs.
Anybody else?
Question for the governor. This is kind of higher level, but I wanted to ask you about your op-ed in the New York Times that ran. Was wondering why you chose to write that and why you in particular chose to criticize Donald Trump and J.D. Vance, because I know it's not something you relish. You don't typically relish criticizing Republicans like that. So I was wondering why you did that.
Well, I'm not sure it's anything was in there that I hadn't already said. Maybe gave some of the background of my relationship with Springfield and Fran's friends, but it was something that I thought was important. I think it was important as the governor of the state of Ohio, to tell the truth about what is going on in Springfield, and to describe this community as I have known it for my entire life. This is a community that has a great, great future. You couldn't always say that. This community historically has been a manufacturing city, forefront of whatever was modern in those days, but that was many, many years ago. The community started going down economically as far as jobs, and went down for a while. What we've seen lately, though, is a great rise, a community that is coming back. More jobs are being created. More companies are coming in here. I see it myself when we are working with Jobs Ohio to try to get companies to come in. And one of the places they look at is Springfield. They don't all end up in Springfield because we don't win all of these. But they're very legitimately looking seriously at Springfield. That is going to continue. So I thought it was important to say those things in this op-ed piece. I think it's also important to point out, yes, we have challenges. We're dealing with some of those challenges right here today. But the economic movement forward could not have occurred to the extent it has, at least, without Haitians coming in and being hired and filling these particular positions. That happens to be the fact. So as governor of Ohio, someone who grew up in Yellow Springs close, who lives in Cedarville, I thought I was in a unique position to talk about Clark County, talk specifically about Springfield.
What's the feedback been like? Tom Perez was in Cleveland today from the Biden White House. He appreciated what he said, but I'm not sure everybody, like maybe Republicans don't feel the same way. So what have you heard?
I've had a lot of nice comments. I'm sure there's some people who didn't like what I said, but I've had a lot of people have reached out to me and said they appreciated what my comments were. Particularly, that was the reaction that we got when Fran and I were here Sunday, and we were here again Monday, just seeing people literally on the street. We had a lot of people who said, who had actually seen it. I was surprised at how many people would, get the New York Times or have access to the New York Times. And, a lot of people were very, very positive about it. But look, I've done this a long time. I know there are a lot of people who probably didn't like it either. So.
Governor, how much is this mobile unit costing the state?
That I don't know. I don't know the numbers. We can get you the numbers. I mean, this is a mobile unit, obviously, that we have. The real cost is going to come in regard to how it is staffed, and there certainly is a cost behind that. But again, what the state health department does is we surge in help when that help is needed. We did that, for example, in East Palestine. We not only set up a mobile clinic, we set up a permanent clinic there. So when we have a hole, when we have a problem, we have a challenge that the local health department does not have the capacity to fully meet, we come in and do what we can do.
Governor, last week when you introduced this mobile health clinic, you said that you were also aiming to help mothers that are pregnant and after giving childbirth. Can you touch on
I think the whole goal here is to just expand all primary care health. Now, as the health commissioner said, our goal is this shouldn't be the permanent, health department should not be the permanent health home, but it can be a first place. And so as you expand the capacity of the primary health care system in the community, you're going to reach all kinds of different people, and all kinds of different people are going to be helped. So that's really what we're doing here.
Governor, you mentioned a 2-month wait time. This is more of a clarification. Is that specifically for the Clark County Health District?
It's my understanding, yes. Chris, is that
That's correct.
correct figure?
Yes.
So it's about 2 months now. That's not good. We don't want people to wait 2 months. They shouldn't have to wait 2 months. So again, what we're announcing today is going to benefit everybody in the community. It's important for these, what we now consider routine vaccinations for children, for adults. It's important for the community health collectively that these take place. It's obviously very important for that individual as well. So it's expanding the bandwidth, so to speak, of the healthcare system here. It's not taking the place of anybody. It's just helping to expand it and really supplement it. Okay, anybody else?
What about in staffing? What's the staffing going to look like?
Yeah, I'll let you all take that.
Yeah, go ahead.
So one of the other supports from the state is that they're sending some surge nurse staffing to us, and we absolutely couldn't do this without that support. So we are using our existing staff, and we're also using the state's staff as well.
So one physician, one doctor, or a nurse practitioner, how?
So for immunizations, those are administered by our registered nurses. And so right now, the plan is to continue to use those registered nurses. I would say there are two, you'll see it in a minute, there's 2 exam rooms in this mobile unit. So if there's 2 teams of nurses, 2 on a team, and then some intake and processing of insurance, things like that. So you could see anywhere from 5 to 7 people on there at a time.
Let me just add something that, Chris, you told me, so you can correct me. But this will also, by doing some basic screening, it's going to pick up if someone has got high blood pressure, and they will then try to put them into the existing system, which might be Mercy, for example. And so this is kind of an initial intake. Let's see if you got a problem. If you got a problem, we refer you over. So it's not just the immunizations. Immunizations is the backlog, but we're going to have people coming in there who they're going to pick up high blood pressure. They might pick up severe, diabetes. There's all kinds of things. And again, the more access you have to health care and the easier you make it for people, it's going to improve the health of the community. It's just very important.
And can you talk about a potential permanent clinic? What would that look like? Where might that be?
Yeah.
What kind of timeline?
I think, it will be looking for a location. The location obviously has to be something that's accessible to people. It has to be something that the people who are most likely to use it will be able to access. So those would be the criteria, and we're looking for that along with the health department. We're looking for that now, and we'll have something in the future to announce, I hope. So.
Governor, as far as addressing the healthcare needs of this community, what is your end goal here? What's the place in your mind that we need to get to make sure this community is in a good spot?
Well, I think the experts will tell us when we are in a good spot. What we do know is that when you surge in 15,000 people, or whatever the exact number is, I don't think anybody knows, but when you put in 15,000 people in a community of 58,000, over a relatively short period of time, it's going to naturally stretch the system. And so what we're trying to do is to kind of fill that gap, reduce the wait time, get us in a place which would be a more normal situation. So, we're going to listen to the experts, we're going to listen to Chris, and we're going to listen to Mercy Hospital, and we're going to listen to other people who are going to tell us when we are at a place where, we don't have to be in here with state support.
Governor, you mentioned there have been other bomb threats. Where and
Yeah, I don't have that. There have been fewer, is what I do know. And again, the mechanism is in place to check those out very quickly now. So we feel pretty good about where we are there.
And how are the schools doing?
Schools are doing good. I've not been in the schools myself, except last week. Fran and I were in the 3 different days. I was in 2, she was in 3. But Andy Wilson, who is in back, public safety, was in the schools today. Would you like to tell them what you observed today?
I was in the schools. I was making my rounds, checking in, making sure the troopers were doing all right, making sure the school staff and kids were doing all right. The first school that I pulled up to, when I pulled up to it, the cruiser was empty. The trooper wasn't there. Trooper wasn't standing out front. So I thought maybe he was in talking to the staff. My liaison that I have with me, I was looking at some stuff on my phone. My liaison said, hey, look at that. That trooper was out on the playground playing with the kids at recess. There was a big group of kids. Keeping those kids safe, making those kids feel safe, and more importantly, just setting a culture and environment where those kids can be comfortable in their school. We see that time and time again. I cannot tell you how many texts I have received from parents, grandparents, teachers that I know in this community who have thanked the governor repeatedly for using the patrol to keep their kids and keep our babies safe. So that's a great thing. I was talking to my director of Homeland Security just before I came down here, and we were talking about the threats that the city and the schools have been receiving, and they have pretty much tailed off. The second that the governor put those troopers into the schools, you saw those threats that were going to the schools move to other places. They went to businesses, they went to hotels, they went to, and then we had a mechanism. The governor used Ohio Homeland Security and some of our resources to quickly deal with those, and then you see them just tailing off. So the resources that the governor has put in to this community across the spectrum of public safety not only are making people feel safer, but they're actually addressing the issue and keeping people safer. So thank you.
And will the mobile units continue to stay, the mobile towers, are those going to, the watchtowers?
Yes, we will keep those here until the threat has subsided to the point where the city of Springfield tells us they don't need them. The beauty of that is we can move them around. Again, we're going to move them around this weekend. They're not static where they're at. We're going to pull some off of some locations they're at. We're going to move them to where we think we may need them over the weekend to address whatever we think the issues this weekend may be.
And is it 4 or 2 of those mobile?
So we have 4. We have 4 from the Ohio School Safety Center, and then we have 2 towers where people can actually sit in from the Ohio Department of Homeland Security.
Okay, so I think now anybody that wants to go through the clinic and take a look at it, I think we're gonna do that. Thanks, everybody.